At the 23rd Health Directors Joint Consultative Committee and 7th Regional Forum on Best Practices in Health, held in Arusha, Tanzania, health officials from the 10 countries of East, Central and Southern Africa Health Community Ecsa came to a decision, getting more engaged in global health diplomacy.
We know our diplomats are in foreign affairs mainly, that's what is expected. But we know that senior officials in the health sector have to sign on documents, global documents on many occasions.
For a long time, this has not been happening and health sectors have been losing out.
In fact, global meetings happening all the time. I mean, we are looking forward to the UN meeting in September. We've just come from the World Health Assembly in Geneva. So they are always, we are a global village, and there are documents which are signed, which are binding to all of us. But sometimes the content of those documents may not always be favorable to our region. So basically what we want is our senior officials to read even between the lines so that whatever is signed up is for the good of our people.
Most of the delegates agree that moving forward, the region should have health attachés in places like New York and Geneva, where meetings and decisions regarding health are taken.
They face quite a lot of challenges, the officers who are currently there, because they consult us back home and normally we do not respond.
Without a response, decisions get made for the region without them having a say. Professor Joseph Wangombe from the University of Nairobi in Kenya says that Africa needs to have a bigger voice.
Where the evidence needs to be generated and analyzed before we go to these meetings, or to even be able to submit issues for discussion being put in the agenda.
This is accompanied with caution from Dr. Rene, the Director, Training and Research Support Center in Harare, Zimbabwe, who says countries have to be clear on some of the bilateral agreements being negotiated to see whether they're in tandem with the region's health plans.
The most successful countries in global health diplomacy are the countries that have got that cross-sectoral coordination. So if we don't have it, we weaken ourselves.
She has encouraged the region to not only stop at being negotiators, but to go as far as implementing what has been so nicely put in the documents. Member states revealed that they'll start a master's program to be run in Nairobi for the Ecsa region in global health diplomacy to prepare countries for the meetups with international experts. Florence Nalimba, NTV, Arusha, Tanzania.